Hello and welcome to Health 247 on Rapid Television, the program that brings you trusted health insights, expert advice, and inspiring real-life stories. Today, we turn our attention on kidney disease, a serious but often overlooked condition that affects millions of people worldwide. I am Josephine Bitrus. Thank you for staying tuned. The kidneys play a vital role in filtering waste and excess fluids from the blood, helping to keep the body balanced and healthy. However, when they begin to fail, harmful toxins can build up, leading to severe complications if not detected early. In this edition, we will explore what kidney disease is, its common causes, warning signs, and how it can be prevented or managed. Stay with us as we uncover the facts behind kidney disease. Often referred as the silent killer, kidney disease can develop gradually without obvious symptoms, making early detection extremely important. The kidneys play a vital role in filtering waste and excess fluids from the blood, regulating blood pressure, and maintaining overall body balance. Health experts warn that conditions such as diabetes and high blood pressure remain the leading causes of kidney disease. Other risk factors include obesity, unhealthy diets, smoking, and a family history of kidney problems. According to medical professionals, many people do not realize they have kidney disease until it reaches an advanced stage. Symptoms when they appear may include fatigue, swelling in the legs or face, difficulty concentrating, and changes in urination. High blood pressure, also known as hypertension, damages the tiny blood vessels in the kidneys over time, reducing their ability to effectively filter waste and excess fluids from the blood. The constant force of elevated pressure causes these vessels to narrow, weaken, or scar, which can gradually impair kidney function and eventually lead to chronic kidney disease if not properly managed.
We have two kidneys in the body that serves as a kind of filtration center for blood purification process in our body. So there are very tiny blood vessels that are found in the kidney. The function of these blood vessels is to help to take blood from every other part of the body to the kidneys so that the kidneys can filter the waste products out of these kidneys and then send back the purified blood into the circulation or to the rest part of the body. Also, another function of the kidney is that it helps to make urine. Okay, so they help to make urine, and then the urine that is secreted and excreted out of the body usually contain impure products that have been filtered out of the blood. So when the blood pressure is very, very high, like significantly high, especially in people who have not been compliant with medication, or they have not, for one reason or the other, bothered to start any medication process that will help to control the blood pressure. Now, these are the people at the highest risk of developing a kidney disease. Now, when this high blood pressure builds up in the blood vessels, what happens is that over time, it's going to damage the linings of the blood vessels. And then it will also cause narrowing. You know that the blood vessels, they look like channels or they look like tubes that allows blood to flow from one part of the body to the other. So when there is a narrowing of the blood vessels, there will not be sufficient blood flowing to the kidneys. And it will also cause damage to the filtration apparatus that is within the kidneys. And so because of that, you notice that there are certain materials like proteins, for instance, that are not meant to be excreted out of the body that will begin to start leaving the body or being excreted out. Also, you also discover that um, there will be buildup of fluid within the body because this fluid is not able to leave our system because the kidneys are damaged through high blood pressure.
In people with hypertension, early warning signs of kidney problems can be subtle and easily overlooked, but may include swelling in the feet, ankles, or face due to fluid retention, frequent urination, especially at night, fatigue, difficulty concentrating, and the presence of protein or blood in the urine.
Okay, for somebody with hypertension that has gone unchecked over a long period of time, the interesting thing about warning signs in kidney failure is that you might not even see it in the early stage of damage. It might just go silent for some time until when the kidneys are getting compromised gradually. And then that is when you notice that the person will wake up and the person will complain of puffiness of the face. So you see very chubby cheeks. Cheeks, the chubbiness of the cheek is not due to weight gain. Then we also see that it's due to fluid buildup in the face. And then also just below the eye sockets, there will be puffiness too. Also, the patient will complain of swelling of the feet as well as the ankles. The patient will also complain that they wake up very frequently at night to go and urinate. And even when they pass urine, when they look at the urine in a toilet bowl, they notice that it's kind of foamy. You know, it's just like when you pour lather, when you pour detergent into water and it forms lather. So that's how it looks like. And that's because there is leakage of protein, which should not be so. Another sign is that the person will complain of extreme tiredness and weakness. The person will also complain that they feel nauseous, like they want to throw up. So these are some of the signs that tells us that something is not going well with the kidneys that need to be checked.
People with long standing or poorly controlled hypertension are most at risk of developing kidney disease, especially older adults, individuals with a family history of kidney problems, and those living with conditions like diabetes or heart disease.
Okay, some of the risk factors when we talk about kidney disease, especially of the chronic kind, are those people who have had hypertension over the years. Remember, hypertension is a silent killer. Most times, even when the blood pressure builds up, there is that tendency that the body might not even raise any alarm. Everything will look fine. But over time, if that blood pressure goes unchecked or uncontrolled, then of course it can result in kidney damage. So it increases the risk. So those who have uncontrolled hypertension. Now, those who have had hypertension for so many years are also at risk. However, it's a very low risk because if the person is under surveillance, that is, goes regularly to get checks by the doctor and also compliant with medication, of course, the tendency of even getting a kidney disease is very low. But anyway, that's one of the risk factors. Also, for those who are who have comorbidities, for instance, people who have diabetes, who are diabetic and whose blood sugar have not been controlled over time, are also at a high risk of having a kidney damage. Then people who have family history of kidney disease, also at a high risk. And then another one is people who are older, because the older, the aging population are very susceptible to certain diseases because the body does not have that ability to be able to withstand pressures that come or insults on the body, and the immune system might, drop a little. So older population too at a risk of having a kidney disease.
To check kidney function in patients with hypertension, doctors commonly use blood tests such as serum creatinine and the estimated glomerular filtration rate to assess how well the kidneys are filtering waste, along with urine tests to detect protein or blood in the urine.
To test for kidney function in hypertensive patients, most of the times we want to use the blood, taking a blood sample. So we'll do the blood test. And we are actually testing for the urea, creatinine, as well as electrolyte function. You see, you want to know how much electrolyte there is and if there is a lot of creatinine or urea. So if the urea buildup is very high, it means that the kidneys are not filtering properly the waste products from the body or from the blood anyway, out of the body or out of the system. Another test we want to do is also the urine test. We do the urine dipstick. So this one helps us to know if there is any leakage of protein or if there are proteins found in the urine. So that also raises an alarm for us that, okay, something is compromised somewhere that needs to be checked before it progresses to end-stage renal disease.
People with hypertension can prevent or slow kidney damage by keeping their blood pressure well controlled through prescribed medications, reducing salt intake, eating a balanced diet, staying physically active, maintaining a healthy weight, and avoiding smoking and excessive alcohol use.
So to prevent kidney damage in an hypertensive patient is just for the patient to be very, very intentional about their health, especially the blood pressure. So regularly checking the blood pressure is very important. And once you know your baseline blood pressure, you're able to take medication to be able to go at that level, not go above it. That is one way. Another way is also being active, engage in weight loss programs, and also increasing your activity rates, exercising, just being very active, then eating properly, good diet is also very important, and which also includes having a low sodium diet. So anything that increases that tendency to eat salty foods or spicy foods, then you try to avoid it. Then for those who have problems such as diabetes, is to make sure that their diabetic profile or the readings are very, very well under control. So these are the things that can either prevent kidney damage, or for those who are already having some level of some maybe minimal loss of kidney function, to prevent it from getting worse over time.
If kidney damage caused by hypertension is not treated, it can progressively worsen, leading to significant loss of kidney function and eventually chronic kidney disease or even kidney failure.
If hypertensive kidney disease is not treated, it will result in a lot of issues. Now, first of all, I want us to understand that the circulatory system is such that some blood vessels that are attached to a particular organ in the body also link with other blood vessels in other organs of the body. So we have blood vessels coming out of the heart, taking blood from the heart, because the heart is like the pumping system or reservoir in the body, which also conveys blood to other blood vessels that will convey blood to the kidneys. So when there is a problem with the kidneys, there is going to be problem with other organs of the body. For instance, it also increases the risk of that patient having a stroke, coming down with a stroke. When the kidneys are not filtering blood properly, it sends a kind of feedback to the heart that there is a low pressure, and then it will now cause the heart to pump faster, and in the process, it's going to cause a heart failure. Also, if there is fluid buildup in the body, it will also result in a problem where the lungs become very, very engorged with fluid, and then the patient begins to complain of shortness of breath, not able to breathe properly, or even lie down flat. So these are some of the issues that can happen, and it can even also damage the eyes. Some people will complain that they are experiencing blurry vision, blood vision, they're not able to see clearly, and that is because there is the hypertension has affected the blood vessels in the eyes, and resulted in damage.
Kidney failure or the need for dialysis occurs when damage from conditions like hypertension has progressed to the most advanced stage of chronic kidney disease, that is stage 5, where the kidneys can no longer adequately filter waste, excess fluid, or toxins from the blood. At this point, kidney function is usually below about 10 to 15%, and without dialysis or a kidney transplant, life-threatening complications such as toxin buildup, fluid overload, and electrolyte imbalances can occur.
So when the kidneys, keep getting progressively worse, there is loss of function, the blood pressure has not been controlled, and over time, the kidneys are not able to filter the waste materials out of the body, or the kidneys are not able to make urine, and the waste products leave the body through the urine, and there is fluid buildup in the body. There is edema, body swelling, and so on and so forth. Then at that point, you know that, okay, there is already complete loss of kidney function, which will warrant a dialysis or a kidney transplant. Whatever results in the damage of the kidneys because of hypertension is also already a sign that the other organs of the body are beginning to get compromised. So the functions of the other organs of the body, like the heart, like even the eyes, like the brain, are gradually getting compromised. So it's just like an imminent sign. So that increases the risk of even the patient having a stroke. That also increases the risk of the person coming down with blindness, and also the risk of heart failure. So the encouragement I have for Nigerians, and it's also a plea, is that whenever you notice that there is a rise in blood pressure, it's not something to sit out or watch. Please consult a doctor so that you can get properly evaluated. If there is any need for any lifestyle modification, that can be done. If there is need to take medication, you can also do that. That will help to improve longevity and also preserve the kidneys as well as other organs of the body.
It is important to note that kidney disease is often a silent stress, showing little or no symptoms until it has reached an advanced stage. Taking proactive steps such as maintaining a healthy lifestyle, staying well hydrated, monitoring blood pressure and blood sugar levels, and attending regular medical checkups can make a significant difference. Early detection remains crucial, and with proper care, many complications can be effectively prevented or managed. Take charge of your health today, because early action can save your life. Thank you for watching Health 247 on Rapid Television. Tune in next week for more. Until then, eat well, stay healthy, and take care. I am Josephine Bitrus.